Hi everyone! In today's video, we will cover high-yield pediatric questions for the USMLE. A 3-year-old girl is brought to the emergency department after ingesting an unknown number of pills left on the kitchen counter approximately 2 hours ago. She's experiencing nausea and complains of stomach pain. Since the ingestion, she has vomited twice and had multiple episodes of diarrhea. Her vital signs include a blood pressure of 98/60, pulse of 110, temperature of 37.2 degrees Celsius, and respirations of 20 breaths per minute. ECG is normal apart from sinus tachycardia. An abdominal X-ray reveals multiple radiopaque objects in the stomach. Ingestion of which substance is the most likely cause of these findings? A. Acetaminophen. B. Imipramine. C. Iron. D. Organophosphates. E. Phenobarbital. The correct option here would be C. Iron. The patient's symptoms of nausea, vomiting, diarrhea, and abdominal pain are classic for iron poisoning. Additionally, the iron tablets are radiopaque, meaning they show up on the X-ray, just like in this case. Now, in iron toxicity, the early symptoms which occur in the first 6 hours are vomiting, diarrhea, abdominal pain, irritability, and drowsiness. And in severe cases, you can see rapid breathing, tachycardia, seizures, coma, unconsciousness, and low blood pressure. Let's have a look at why the other options are incorrect. Option A, acetaminophen. Acetaminophen toxicity can cause nausea and vomiting, but the key reason we can rule it out in this question is because acetaminophen is not radiopaque. This means it wouldn't be visible on an X-ray. Since our patient has radiopaque material in the stomach, acetaminophen is not the answer. Option B, imipramine. Imipramine is a tricyclic antidepressant, and while it can cause serious toxicity, its hallmark effects are CNS depression, disorientation, seizures, and arrhythmias. The classic ECG findings include QRS widening and QT prolongation, which are not present in this patient. Option D, organophosphates. Organophosphates are acetylcholinesterase inhibitors, which means they cause overstimulation of muscarinic and nicotinic receptors, and the typical symptoms include hypersalivation, tearing, urination, diarrhea, and muscle weakness. Our patient does have diarrhea, but he lacks the other key signs of organophosphate poisoning, so this option is incorrect. Option E, phenobarbital. Phenobarbital is a barbiturate, meaning it causes CNS depression. However, another important fact to remember is that phenobarbital is not radiopaque, so it wouldn't appear on an X-ray. Since our patient has radiopaque material in the stomach, this choice is incorrect as well. A 26-year-old mother brings her 6-day-old infant to the clinic concerned about eye discharge that began earlier that day. The baby was born at home and the mother did not receive any prenatal care. On examination, the infant has bilateral purulent eye discharge, eyelid erythema, and conjunctival inflammation. Which of the following is the most likely causative organism? A. Bordetella pertussis. B. Neisseria gonorrhea. C. Parainfluenza virus. D. Respiratory syncytial virus. E. Treponema pallidum. The correct option here would be B. Neisseria gonorrhea. Gonococcal conjunctivitis presents within the first week after birth with bilateral purulent discharge, as we can see in this patient, and the lack of prenatal care in this case also increases the likelihood of an undiagnosed maternal gonococcal infection which has been passed on during delivery. Let's have a look at why the other options are incorrect. Option A, Bordetella pertussis, is incorrect because it is the causative agent of whooping cough, which presents with severe coughing fits followed by a whoop sound during inhalation. And this infection typically affects older infants and children, not newborn, and certainly would not cause purulent eye discharge. Option C, parainfluenza. Parainfluenza virus is typically associated with croup, which presents with a characteristic barking cough. It affects the upper respiratory tract and not the eyes and would not cause purulent discharge in the eyes. Option D, RSV virus. So RSV is a common cause of bronchiolitis in infants. It does not typically cause conjunctivitis, and since this patient has no respiratory symptoms and the issue is strictly ocular, RSV can be ruled out. Option E, Treponema pallidum, is incorrect because this is a causative organism of syphilis. While syphilis can cause congenital infections, conjunctivitis is not its primary manifestation.